NEET PG 2026 is going to be the toughest NEET PG in the history of medical exam. For that reason, I am going to tell you some tips, tricks to know your mistakes and how to rectify them in this last few days so that you can give your best shot in the NEET PG 2026. And in the end, I have some advice for those who have not prepared at all properly so that they can boost their rank to approximately 30,000, 40,000, or 50,000 rank so that they can get any DNB clinical branch or decent pre and paraclinical branch of their choice. Why it is going to be the toughest NEET PG? Because this year 2.73 lakh doctors have registered. In my year, it was 2.24 lakh. That means in a span of just 3 years, 50,000 more aspirants have been added in the exam. So the competition is rising. And how we can know this? Because this time the INICET exam was a bit difficult, but still the cutoff was raised. That's why the competition is rising. This year, seeing the trend of papers, INICET was difficult, FMGE was very difficult, pass rate was only 12%, re-NEET exam was also difficult. So will NEET PG 2026 be difficult? Let's see the marrow mock because it foretells the pattern of NEET PG. As I have said, it was moderately difficult. This time it was given by 99,000 aspirants. My year it was given by 90,000, so an increase of 9,000. But ranks were absurd. The only reason that you have not prepared well is not the reason. Many are using unfair means and using AI. In our time, AI was not that much well developed that they can see pictures and they can give the accurate medical answer. But now AI is very much advanced and it can give accurate answer. So many are using this, and this is the huge lot. And there are many final year and intern students who won't appear in NEET PG 2026, but they are giving it for their practice. Like in our time also, there was a guy who used to rank in the top 50, but he was 2 years junior to me, and a girl was also there. So she is now in AIMS Delhi, and she was 2 years junior to me, but she was in top 50 during my mock tests. So there are many brilliant students who are final year and intern. They are also appearing in the exam. Your corrects don't matter, but you will have to review the mock. Before I go into how to analyze your mock exam, do subscribe to my channel if you are new to my channel. Coming to categorize your mistakes based on two option confusion. If you are having two option confusion, then it is more of an application based error. So solve more and more MCQs. How to solve more and more MCQs, I am going to tell in the further video. If you are confused between three option confusion or four option confusion, then it is more of a knowledge gap and you need to revisit your rapid revision source, be it from any source RR or BTR. Based on category of mistake, if it is silly mistake, it is the easiest to rectify. You can't afford to have more than one silly mistake. In NEET PG, I had, I think, 2 to 3 silly mistakes. In INICET, I had 5 to 6 silly mistakes. So my rank dropped. So you can't afford to have more than one silly mistake. You can afford to have one silly mistake, but not more than one. How you can avoid that? You will have to read each and every word line by line. Use your hand instead of cursor to read each and every line of the question and increase your focus so that you are able to think what the question is telling you. Do not miss the knot, except whether it is electron microscopy, whether it is light microscopy, you will have to see that in the question. Like in ARIA NEET PG, there was a question given after respiratory tract infection. The patient was having hematuria and the BP was rose. So this was a case of PSGN, but suddenly, after one day, his creat rose above 5 times and his pressure also rose to 180 by 120. So this is a case of PSGN transforming into RPGN. In the question, Seeing that this is a case of RPGN, everyone marked the answer as crescent. But the question was asking what is the electron microscopy finding. क्रेसेंट तो लाइट माइक्रोस्कोपी में दिखते हैं ना. सो इलेक्ट्रॉन माइक्रोस्कोपी फाइंडिंग विल बी अगेन द सब एपिथेलियल हम्प्स ऑन. आई read the question carefully. It was electron microscopy and I marked it correctly. So you will have to read each and every line of the question, especially the last line. If it is your recall error, then you will have to go into your RR source and you will have to master it. If it is a new information, and more than 40% are getting it correct, because in NEET PG, except one or two questions, there will be no question that less than 40% are getting correct in the GTs and it is being repeated in the NEET PG. So if more than 40% are only getting it correct, add it in your notes or your GT mistake copy, anything which you are having. If it is a conceptual error, now it is not the time to revisit your videos. So use ChatGPT, it gives very good explanation. Coming to application based errors, you will have to practice more and more MCQs. Which MCQs? I will tell. Firstly, identify your weak area from this. Either your revision recall error is more, or your 3 to 4 option confusing questions are more, then you will have a knowledge gap. And if your application based errors are more and two option based confusions are more, then which you are having is your MCQ solving skill need to be improved. For the knowledge gap, review all the previous year questions explanation from first to last, because that is the most high yield material which you can get. 5 years of NEET PG, 3 years of FMGE, and 2 years of INICET, and do this from Marrow or PrepLadder, no other app, because no other app is that much authentic in the explanation. Revise your revision notes and you do one custom module, 36 question. What will be the tags? I'm going to tell in the future slides. And you give two GTs, one on 16th August, one on 19th August. After that, you don't give any GT. For those who have MCQ solving skill deficiency, you give daily 3 custom modules, one of weak subject, two mixed bag, 36 questions in exam mode you will have to give. This is very much important, the hashtags. Take a screenshot or you can join my Telegram channel. I will provide this PDF in my Telegram channel. Hashtag recent NEET, hashtag aims, hashtag image based, hashtag graphs, hashtag clinical, and one new tag is being added in the Marrow QBank, that is hashtag GIF based. Rest time, you revise. Rest of the time you are getting in the day, you revise your revision notes and you give 3 GTs, because you are having deficiency in MCQ solving skill. So the best way to solve MCQs is by giving a GT. You give a GT on 11th, on 16th, and on 19th. You give either from Marrow, PrepLadder, or Cerebellum. Now I know that many of you are using BTR, but the BTR GTs are very much difficult. I am getting the review. So from these three platforms you can do the GT and you won't lose the motivation that I am getting so much less number of corrects. So I advised these techniques to one of the student who booked my personal session, and his corrects rose from 110 to 140 corrects. Those who haven't prepared till now and you want to get a 30 to 50,000 rank, for those you go through NEET PG INICET FMG 10 years 3 list separate wala link. Okay, link is given in the description box below and pinned comment section. Print it out and read those topics from your RR or BTR. If any topic is missing, add it from your main notes or chat GPT, and you practice at least 3 years of NEET PG previous year questions and the last paper of FMGE. Other reasons why your score is low. First thing, one major rule is if you are confused between 4 options, never attempt the question, because you are going to get it negative. Most number of chances is that. And you will have to attempt high, at least 170 plus. One of the doctors booked my personal session and he said, sir, my corrects are coming 80 to 90. First question I asked, how many attempts you are making? Then he said that I am only attempting 130 questions. I asked, if you are confused between two options, you are attempting it or you are leaving it? He said that I am leaving it. I said the main thing that you need to do is you need to attempt high. At least 165 to 170 questions you need to attempt. अगर उतना अटेम्प्ट नहीं करोगे तो फिर तुम्हारा करेक्ट्स बढ़ेगा कैसे? अगर अटेम्प्ट ही कम करोगे तो फिर तुम्हारा करेक्ट्स का नंबर भी तो कम होगा. And the competition is rising. Why I said you? Because you will have to give the very best, you will have to attempt high in this year NEET PG, because cutoff is going to rise if the question standard remains the same. And the other cause is not reviewing all the previous year topics just before giving a GT. For that reason your GT corrects are not improving. I know a guy whose GT corrects and GT score was 720 and his main NEET PG marks was 650. And I also know a guy whose GT marks was 480 and his main NEET PG exam score was 630. So your GT corrects don't matter. Don't lose hope in this last few days seeing the GT scores of your friends or your own corrects are reducing. You will crack it because you have cracked NEET UG, which is far more difficult, and you are surely going to crack NEET PG also. And I want to say it that the difficulty level of the exam in this scenario does not matter. Why? Because this is an exam of elimination, this is not an exam of selection. FMG is an exam of selection, NEET PG is an exam of elimination. So they are eliminating the non-serious candidates from the serious ones. FMG, if the question paper is difficult, the pass rate is low. But NEET PG, if the question paper is difficult, only the good students are going to score better. And if the paper is easier, there is more clustering. But one thing I can assure you that just like other year NEET PGs, this year NEET PG will also be more of PYT based exam. So do subscribe to my channel, and if you are having any queries, at first subscribe to my channel and do let me know in the comment section. I will try to reply your queries. And if you have not seen how to prepare these last 30 days for NEET PG, go watch the video now. All the best for your NEET PG.